extra time, I've got another presentation we can sort of slip in at the end about urology and geriatrics.
I think it's muted.
Sorry, we cannot hear you.
Can you hear me?
Yes,
Yes.
we can now.
Cool. Okay. Hello, I'm Hilary. I'm one of the F1s on gastro at the moment. And when I was working on frailty in my last rotation, I discovered that I shared a passion for sea swimming with Dr. Alexander. So I like to swim in the sea, and he likes to swim in cold water inland, which is actually a little bit cooler. But as you might have noticed, it's started to get a little bit warmer outside now, but the sea temperature is still dipping. So like one of the main things I wanted to talk about today is how much fun it is to swim in the sea, but then also to go on to some of the things that you've got to look out for. And I'm going to try and change the slides, but let me know if it doesn't work. Okay, so during lockdown, loads of people have actually started open water swimming. And one of the reasons, I guess, is you can't do a whole lot else. But also, I think it's probably because it's really helpful for resilience and just generally feeling positive. And I think after the time we've all had this winter, it's been such a lovely thing to be able to do. And that slide there is the picture outside my garden in the morning. So as the sea was getting a little bit cooler in the autumn, you can see all that steam coming off. And that really does make you feel a lot more positive about coming in to work, even on a Monday morning. So when I first started sea swimming when I moved to Wales, and there's nothing more I love than recruiting people. So if I hang around me long enough, I will try and get you into the sea. And I think that's because it really does an awful lot for your health. But it's also, yeah, as I said, it just gives you loads of energy, makes you feel loads more positive. I'm going to talk a little bit about some of the dark sides, the hypothermia risk, and then also the new research on the dementia molecule, RBM3. And then Dr. Alexander will talk through shock, cold shock. Sorry, my slide's not moving. Oh, right, okay. Just push that, is it? Okay, so a little bit on the dark sides first. It's a leading cause of death worldwide, both drowning and hypothermia, so losing your life in cold water. And the statistics don't come close to what they probably are in reality, because most of the drownings actually happen in countries where the public health systems aren't quite so developed. And also, sadly, where people don't learn to swim so much in school like we do. And then onto the hypothermia side of it. There's actually a really big difference between the temperatures of the coastal water and the inland waters. So here at the moment, the sea is around 8 degrees, 7 to 8 degrees, and it's still dipping. But the inland waters can actually reach 0, pretty painful to swim in. So thermoneutral water is around 35 degrees, because obviously it transfers a lot quicker in water than air of the heat. So I put this slide up because I thought it was quite helpful to have a context of the different feeling of the cold, how it feels to be cold in air compared to how it feels to be cold in the water. So like this morning when I headed out, heading towards my swim in the sea, feeling a little bit nervous about it, but thinking, well, I've got to do this talk at lunchtime, not so much looking forward to that, better get in the sea. It felt quite warm and spring-like in the air, but getting into the actual water is still quite a shock. And as you can see from the water side of that grid there, when you get below 5 degrees C, it's quite painful. So I want to have a look at the different ways hypothermia affects your body. And I thought it'd be helpful to think about a case in question. So taking this 47-year-old chap, Jason Zerganos, who was an army major, and he swam to his death. I want to have a look at the different things going on in his body during that process. So first of all, at mildly cool temperatures above 32 degrees, your thermoregulation will help you maintain your core temperature. But once you drop under 32, you can't sustain it either through voluntary or autonomic action. And then when you drop to below 28, you're quite likely to start to develop cardiac arrhythmias. And at that point, even if you have the best supportive treatment and care, the mortality risk is still around 40%. So looking at the different things that are going on around the body. First of all, when you get very cold, you're driven to consciously seek warmth. So you start moving faster, you activate your shiver response, and your adrenal activity goes up. And that's the bit that Dr. Alexandra will talk to you about next. But organ by organ, if you're looking at the changes in the heart, first of all, you've got the pacemaker cells start spontaneously depolarizing, and the potassium channel conduction slows globally throughout the whole heart. So looking at the ECG, you'd see prolonged intervals, all of the intervals would get longer. Obviously, this is a particular risk to people with genetic conditions who don't know about it. And that's why we all know from PassMed is the swimmer who dies at a young age. You ask about the family history. So yeah, a big risk of VF under 28 degrees. And then looking at the kidneys, the blood flow drops to around 50%, and the temperature below 28 degrees can cause direct damage to tubular cells, which then disturbs your acid-base balance. At the same time, you stop reabsorbing water so well, which reduces your blood volume by about a quarter. And you feel this in the cold diuresis that you experience often when you're swimming or diving. So then, looking at the lungs, under 32 degrees, your spontaneous respiratory rate decreases. And as your temperature drops further, the CO2 molecules become more soluble. So that also contributes to respiratory acidosis. And then looking at the changes in the brain, firstly, your nerve transmission slows down. And at the same time, your capillaries become less perfused. And this is partly explained by the increased viscosity in your blood. So every temperature degree drop you have like a rise of about 2% in hematocrit. So you get like sludging in the veins, and you can get emboli, which could then lead to hypoxic brain injury. Then we all going through the causes of heart attacks and things. We all know about pancreatitis being common in hypothermia. And so you get hyperglycemia from reduced insulin secretion. And at the same time, very cold muscles are respiring anaerobically, so you increase your lactate burden on that side. This builds up in the tissues because the liver can't process it at the low temperatures. And so the respiratory acidosis is then compounded by a metabolic acidosis. And then finally, your limbs lose coordination and become paralyzed directly by the cold itself, and also from slowed nerve conduction. So going back to Major Zerganos, he died when he tried to swim the Irish Channel. And he was a really very experienced swimmer. He'd previously swum the Bosphorus, and he'd done various outlandish swimming feats. A couple of them he'd had to be fished out pretty cold and not moving a great deal. But when he tried to swim the Irish Sea in 1954, I think he was going for quite a few hours when they finally fished him out and found that he was in VF. So Michael Tipton and his colleagues carried out a number of experiments which might explain how he died. His group who do a lot of work in this area, they showed that although we can lose consciousness at about 30 degrees, your muscles can still work fairly well down to about 27 degrees. So whilst you're swimming really hard at this point, cold blood from your limbs mixes with your core temperature, with your core blood, which lowers the temperature of the body uniformly throughout. And this means you can become unconscious before you stop swimming, which is kind of a weird, bizarre concept. So then looking at ways we should look after patients who come in and need treatment for hypothermia. The two risks you're trying to avoid are hypovolemic fluid shifts and also having a big load of metabolic acidosis as your anaerobic waste returns to the main circulation. So if you can cool people who are mildly hypothermic very gently and use lavage and fluids to warm people if they're severely unwell. But remember also that the cold is quite neuroprotective, so it's actually worthwhile trying to resuscitate for a really long time. Even after the pupils look fixed and dilated, you should still continue doing CPR. And this was found by a Norwegian study in 2014, where they actually got a ROSC from a young girl who they'd been working on her for 6 hours, over 6 hours from 13 degrees, which is quite amazing and a bit of an outlier. But it does say that's where the phrase "don't stop until they're warm and dead." So we all heard a little bit about cold water links and dementia in between all the COVID stories last summer and autumn. And I thought it was quite interesting to have a little look into this. So if you survive your hypothermia, you might do pretty well later on in life. And the work that was done on this molecule was found from looking at hibernating creatures who actually prune back some of their unused neurocircuits to save energy when they hibernate. And in 2015, a group from Cambridge compared the difference between normal mice and mice with dementia. And they found that the healthy mice were able to restore their synapses and link those cells up together again after their hibernation, whereas the mice with degenerative diseases weren't able to do this. So the molecular difference they found between the two groups was RBM3, which they then referred to as the hypothermia marker. And this molecule can stabilize messenger RNA below 32 degrees and accelerate your ribosomal assembly and therefore increase protein synthesis to remake those synapses. It also promotes proliferation by stimulating your neuronal differentiation, so it's active in the hippocampus. And it was really quite lovely how they found this out, because there was a Professor Malucci from the Dementia Research Institute who wondered about this molecule RBM3 and wondered if it could protect against degenerative diseases in humans. And so she spoke about this idea on Radio 4, and she was chatting through it and reflecting that it wouldn't be very ethical to make people hypothermic to check. But then a swimmer from the cold water pools in Hampstead Heath called up afterwards and offered to help out, because he said, well, we make ourselves hypothermic just for fun anyway. So over the next 3 winters, they used a group of these swimmers from the Hampstead Heath ponds and showed that they were all going below 34 degrees. And sure enough, they did increase this molecule. So assays did show that it increased in all of these swimmers. And separately, they've also shown that this molecule is raised in both babies and stroke patients who've been given hypothermia treatment. So thinking about the number of people who are suffering from these diseases and how much bigger a problem this is going to be going forward for all of us, it's pretty exciting to see these early studies showing such positive outcomes, really. So I hope that you maybe consider having a dip in the sea, because it's such a beautiful place to be in Eastbourne. And honestly, it wasn't so bad this morning, and it really was lovely yesterday when it was really sunny. So yeah, my recommendation would be to get in and have a go. I've got some references if anyone's interested, but I think the pictures are better. So I'm going to pass you over to Dr. Alexander, who will talk a little bit about cold water shock. Thanks very much.
Does anybody have any questions? Just get my presentation up. Everybody see that? Very good, Hilary. Well done. Thank you very much indeed. That was marvellous. We would sort of, I could have talked first or second, but anyway, so this is, we've done the hibernation and dementia. What I wanted to talk really was about cold water shock, which is another significant danger for swimming in cold water. I haven't swum as regularly as Hilary, but certainly this is where I was swimming up until the beginning of November. This is Pell's Pool in Lewes. I think this is probably taken on a lovely summer morning in the middle of July, probably when the air temperature is 15 degrees, but the swimming pool temperatures remains very, very cold. And in November, before they closed, it was 11.5 degrees centigrade. Again, a little bit about statistics. I mean, I'm sure many of you remember the poor chaps who succumbed in Hastings not that long ago. And there were a couple of swimmers who sadly succumbed at the end of last year, both very good swimmers. But the WHO reckon that there are 372,000 deaths per year. And again, as Hilary was saying, most of these figures are underestimates. Certainly the UK, it's the second highest cause of accidental death in children and the third in adults. And very sadly, we lose a child a week in the UK from drowning. Now, Hilary's talked about two stages of the risk. Now, there's sort of four stages of risk that we should watch out for. Actually, Hilary's covered almost all three of those. I'm going to cover the first one. The second one is obviously that as you get colder, you become more incapacitated before you develop hypothermia. And then something I'll talk about at the end is this circumrescue collapse, is when you think everything's over and everybody's safe. Actually, that's probably one of the most dangerous times. Exposing yourself to this kind of cold water is probably one of the greatest stresses you can put your body through. And we're both talking about temperatures of less than 15 degrees. If you imagine the local swimming pool feels cold if it's in the sort of low 20s. You know, you're sort of pleased. It's probably a bit warm if it's 28, but if it's 24, you know about it, and it starts to feel quite cold. Pell's never really gets to above 20 degrees, even in the middle of summer, and always feels quite chilly when you get in. But in the past, there was this, they described it as hydroacution. There was sort of people who were dying very, very quickly after they got into the water. And they were thinking that this probably wasn't hypothermia. They're not in the water long enough to get cold. And if you look at the sort of Home Office statistics from about 1977, 55% of these deaths happened within the relative safety of the shore or the side of the pool or wherever they were, within 3 meters of safety, and 40% happened within 2 meters. And a good proportion of these people, sadly, are good swimmers, 2/3. So, you know, they started thinking this probably isn't hypothermia, because as Hilary was saying, it takes probably 30 minutes before your core temperature gets cold enough to start upsetting muscle activity and nerve activity. So this chap Tipton, who's a physiologist who works with the Navy and in an extreme laboratory in the Navy in Portsmouth and Southampton, they started to see and describe this cold water shock response. And this takes sort of threefold. This is a huge gasp for air as you get into the water, or as you dive in, or as you're submerged. And this is followed by an uncontrollable hyperventilation. And then as a result of that, then there's a large rise in blood pressure. And I think this is what's seen to cause problems in people with underlying heart disease. This was sadly seen in the 1940s in Germany and Poland, but more recently, this Mike Tipton had sort of seen this inspiratory gasp and described it in 1989. And going into water at 28 degrees, which isn't that cold, it's potentially 2 liters of air. So it's a big uncontrollable gasp, and up to 3 liters when it's 11 degrees. And you feel it when you get into the water. Even if you get in reasonably slowly, it's a real kind of uncontrollable gasp. And this was, again, this has been known about for some time. And especially when you compare it the amount that you need to drown, that people think that about 1.5 liters is enough to drown. These volumes are large enough to cause great problems, and therefore if you're under the water when you get this uncontrollable gasp response, that's when people never then reappear, and was described as a sudden disappearance syndrome. So they dive in, they get an uncontrollable gasp, and that's it, and unfortunately never resurface. And then after the gasp, then there's this huge drive for sort of hyperventilation. And I don't know whether if you want to swim underwater for any length of time, you hyperventilate to drive down your PCO2. But doing that doesn't seem to have any effect, and you still got this huge drive for hyperventilation after the initial gasp. It becomes very difficult to hold your breath. And again, if you've tried to swim a length underwater, you'll know that it's tough. But at 15 degrees, there's no chance. It's very hard to hold your breath under the water. So people who can hold their breath for 45 seconds in a normal pool find it very difficult at 15 degrees. And when I first started swimming last year at Pels, there's this very odd feeling of despite breathing fast, you feel almost as if you're being suffocated, and it takes a bit of getting used to. So why? What's the mechanism? So cold receptors, cold skin receptors, very close to the surface, so they're not insulated at all, and obviously they are stimulated by a rate of change of skin temperature. So if you change the skin temperature very quickly and expose lots of your skin to the cold water, it's going to be far worse. And I think that's one of the benefits of wearing a wetsuit. But there is some adaptation over a period of about 5 minutes. And as Hilary was saying, this sort of explains why cold water feels very much worse than cold air at a similar temperature. And in fact, she mentioned the fact that, I mean, at about 15 degrees and below, it's painful. It's not just cold, it's agony for a bit, but you do get used to it. After a couple of lengths, you get used to it. But anyway, so stimulation of these cold water receptors causes vascular resistance, and this is what puts your blood pressure up. And I think this is where the relationship with heart attacks occurs. I don't know whether you can see that. So this is a picture of the physiology, and only those in the audience can see the respiratory rate coming very, very, very fast, and wrapping. And obviously the hyperventilation is one of the reasons why people become, well, they feel faint, they get numbness in their fingers and toes, they get cramp. After a short period of time, it does reduce your ability to carry out simple tasks, and eventually leads to loss of consciousness. And I think it's clear that the lower the temperature, the greater the problem. And this is the sort of thing that's leading to what's called swim failure. Disorientation, fear, panic. I mean, that feeling of suffocation is quite apparent, and you can see how that can lead to panic. Feeling of the inability to think clearly, freezing, helplessness, all sorts of things. And again, this can happen very close to the water's edge, and hence the sort of national figures in the 1970s when they felt when an awful lot of people succumbed very close to safety. And I think the worry is even in the sort of spring, the summer, as Hilary was saying, the water in UK coastal regions and in lakes and rivers is cold enough to cause these problems. So the other problem it can cause is arrhythmias, and I think this is this sort of concept of autonomic conflict. Cold water immersion can lead to high incidence of arrhythmias in healthy volunteers. And this was noted in the 1970s. This was Korean female divers, and noting that there was a huge a difference in the incidence of cardiac arrhythmias, 43% in the summer and considerably more, 72% in the winter. And the reason behind this is this sympathetically driven tachycardia, the sort of cold shock, and the heart rate and respiratory rate, the drive that we've seen in the last few slides. And this is against the parasympathetic driven bradycardia that you see with submerging, putting your face in the water, and the sort of vagal stimulation. So there you go. So the sudden and profound cooling of the skin versus the diving response, the cooling of the oronasal area, and that's the conflict. Add to that breath holding, and some time ago they discovered that this autonomic conflict and holding your breath, and more importantly release of breath holding, caused all sorts of arrhythmias. Back to Tipton in 1994, and then again in 2010, he found that the majority of arrhythmias happened within 10 seconds of a release of a breath hold. And of course, this is the bit that's not picked up at post-mortem, but you can see the difference. This is looking at healthy volunteers with people. So exercises, free breathing with a head out of the water, there were very few arrhythmias, only 2%. But if you've got your head in the water and your breath holding, obviously trying to stay alive in some cases, the rate of arrhythmias is vastly increased to 62 to 82%. And here's a slide which shows you a bit of an example. The sort of breath hold happened at the arrow, and then you've got all sorts of tachyarrhythmias happening afterwards. Link with sudden death and the cold. I mean, they've seen we obviously know there's a bit of a link with sudden death early in the morning. There's also a certain link with the winter. So when the weather's colder, there is another link with sudden death. But there's also seems to be a link with stress triggers, and obviously we see all sorts of cardiac arrhythmias and problems with anger, sex, grief, fear. The thing that they concluded was that it was more important if this was unplanned stress, i.e. the autonomic conflict, if this stress was a complete surprise out of the blue on waking, it was likely to be more dangerous. And I think that goes with the sort of jumping in cold water, which you're not used to doing. So we've covered, so that's stage one, the sort of shock, the cold water shock response. Stage two, Hilary covered the decreasing muscle strength and dexterity. I mean, obviously your limbs will get colder quicker, nerve conduction slows, and it does become quite difficult to swim in those conditions. Stage three is the hypothermia, so longer term immersion, probably half an hour. You can maintain your body core temperature until about half an hour in majority of water unless it's very cold. But stage four is that one to remember on the beach. If you ever come across somebody who's brought in, it's a high proportion of deaths are related to circumrescue. There's some sort of, is it a turning off of the fight or flight response? You know, people say, oh, don't worry, you're safe now. They haul you into the boat and bingo, everything shuts down and turns off. And I think the RNLI are trained now not to do that, not to say all is well, you're safe now. It's actually to try and keep you fighting so you don't lose that fight or flight response. Keeping people horizontal is obviously important, otherwise you get loss of blood pressure, loss of venous return. I think Hilary mentioned that the diuresis you get and obviously there's an increase in your blood viscosity in the cold, and there's also an element of hypoxia. So I think all these contribute to, you know, a slightly delicate time, which obviously the RNLI and other emergency services are trained about. And I must say, I didn't know any of that prior to doing this talk. A bit about drowning. We were going to talk about the difference between salt and freshwater drowning, but I don't think there's a huge amount of difference. I think a lot of it is that the amount of water you need to drown is very much smaller than they thought previously. And there's something called dry drowning. There's quite a lot about laryngospasm after only breathing in small amounts of cold water, and it's that causes the problem and stops the gas exchange. And it's not the big volumes that they thought in the past. Oh, and here's, so most of my references are based on the RNLI data, and there's been a new drive from the RNLI about floating and keeping your head out of, or obviously keeping your mouth out of the water, but keeping your head out of the water, keeping water away from your face, and trying to float rather than doing any swimming at all. It's all about floating and letting this first cold water shock sort of time pass, and then regaining your composure by floating. But this is Tipton's work, who's the head of naval research at the University of Portsmouth, and has written some very interesting stuff about it. And I think that's me. Are there any questions? All very quiet. Would have been amazing yesterday. I feel very jealous for all the people who went swimming at Eastbourne. You didn't. There were lots of people at about 4 o'clock off the end of the esplanade at the seafront here. Good. Thank you very much indeed. Thank you.